Professor Tudor-Williams, would you like to say a few words and introduce yourself to our audience?
Thank you very much, Julia. I am infectious diseases professor at Imperial College in London, recently retired, but I was for 27 years practicing as an NHS consultant in children's infectious diseases at St Mary's Hospital in Paddington, which is part of Imperial College Healthcare NHS Trust. And in that time, I saw a lot of children with tick-borne infection.
I'll ask you some questions. So there'll be questions about what any parent might want to ask you if they could ask you themselves. So obviously the first question is, what is Lyme disease?
So Lyme disease is a bacterial infection. It's transmitted to humans by the bite of an infected tick. And so children can get infected if they have a tick attached. And in fact, Borrelia is a big family. This is the name of the bacteria is Borrelia. And there's a big family of different Borrelia species around the world. So in fact, depending on where you are when you contract Lyme disease, the signs and symptoms can be a bit different because the species are a bit different around different parts of the world.
How can my child get Lyme disease?
The first part of being able to get Lyme disease is for your child to be in contact with the places where ticks live. And ticks live typically in grassy areas near woodland, they live in heathland, they do live in parks and gardens, especially where there are wild animals around. So the kind of parks where deer and other wild animals roam. They live, in fact, on small mammals and birds. And humans just get infected if they come up against them. And typically walking through grass, fairly long grass, is a good way of coming across ticks. But also animals will pick up ticks, and so dogs that go roaming in the countryside may come back with ticks, and so they can be transmitted even within the home.
What areas of the UK would you find ticks?
So there's been some lovely work done a number of years ago now, something called the Big Tick Project, which involved vets sending in ticks that have been collected from their patients, from dogs that were brought, with up to half a dozen ticks from a dog would be sent off to the national reference to one of the reference laboratories. And the Big Tick Project is brilliant. It shows you this incredible distribution of different ticks that can carry Borrelia, but the sheep tick is probably the most common of the ticks in the UK that is a culprit. And if you look at the map, it is distributed all over the place. You don't have to go to the Scottish Highlands or to the New Forest in order to come across these ticks. And there are several other species of ticks that can carry Lyme disease. So have a look at the map. It's really a strong illustration that these ticks are very widespread. They don't respect county borders. They are everywhere.
Do all ticks carry Lyme disease?
Is a really good question, and there's very good evidence. The national surveillance for tick-borne infection is carried out down at Porton Down. The rare and imported pathogens lab is responsible for the NHS surveillance in the UK, and the answer is that the vast majority of ticks do not carry human pathogens. So somewhere between 2 and 5% of ticks may carry Borrelia species, sometimes a bit higher. A recent survey in Richmond Park in London, which is known to be a place where people have contracted Lyme disease, only 8% of the ticks were found to be carrying Lyme disease. So in fact, if you find a tick attached, it's far more likely than not that it will not be carrying Lyme disease bacteria, the Borrelia bacteria.
What should I do if I find a tick on my child?
The most important thing is to be being vigilant to try and find the ticks in the first place. And in fact, the Lyme Disease UK website gives you a very nice idea of how big these ticks are, especially the nymphs are very tiny. So if your child has been somewhere where they might be exposed, if they've been on a camping trip, if they've been out wandering in the heathland or grassland, it's really good to have a careful look everywhere, including in the armpits. Children obviously are at a different height to adults, so that they when they're going through grass, the ticks can attach anywhere on the head, on the neck, on the shoulders. They will crawl across the skin as well and find nice, warm, moist places like the armpits or in the groin. So it's important to have a look carefully for the ticks. And then if you do discover one, do not use petroleum jelly or match heads or any other kind of applications. The thing to do is to detach the tick from the skin. And again, on the Lyme Disease UK website, there's a very nice examples of the kind of tweezers. You need really thin pointed tweezers to be able to get between the mouth parts of the tick right close to the skin and lift it away from the skin, ideally with all the mouth parts intact. There's also tick tweezers or tick removing devices that again are illustrated on the website, and it's really sensible to be aware, if you live anywhere near tick country, to use a tick removing device, because you can twist these and lift the tick away from the skin without any of the body of the tick being squished. Because if you squish the body, if you squeeze it, then what you do is you empty the contents of that tick's stomach back into the skin, below the skin in your child. And then that's a really good way, if there is any Borrelia, any bacteria in that tick, you push it into the child's body. So that's clearly a bad idea.
What symptoms should I look out for if my child gets bitten by a tick?
So the first thing is that the bacteria will take some time to become active and to replicate, so that you won't see symptoms immediately. And so any time after the first few days after tick infection, but up to potentially even 3 months. I mean, typically between a week and maybe 21, maximum 30 days, you will see things like the classic is the erythema migrans rash, which is a red ring that expands and is painless and not usually itchy. And it can be single, it can be multiple, it can be at the site of the tick bite, or it can be elsewhere. And of course, quite often you don't even know that the child has had a tick attached. So an unusual red rash that is different to anything your child's had before, that is day by day getting expanding, and it may leave in the center a little target. So the classic description is a target lesion, but actually quite often it doesn't look like that. It looks like a big red blob or blotch, and the important thing is that it's getting bigger day by day. Then that's one manifestation. The other thing that I think is really typical from my experience is summer flu. So if your child develops flu-like illness in the middle of summer, which is obviously not typical of when flu is very prevalent, if your child gets headache and malaise and maybe some fever and fatigue and maybe complaining of some joint ache or muscle aches, then that could be a manifestation of Lyme disease. I mean, of course, there are many other reasons that children get those kind of symptoms, but in the middle of summer, it's obviously a bit unusual to get flu, and I would be alert to that. And then there are some specific things that Lyme disease can do, because it can affect the nervous system. And one of the things that it can do is to cause a weakness of one side of the face. So you get a facial nerve palsy. And in Europe, particularly, the species of Borrelia can cause inflammation of the ear. So the whole of the pinna, the earlobe, gets red and swollen, and again, not particularly painful. A very unusual manifestation of Lyme disease, and it's not even described really in the United States. but it's certainly something that we see in European ticks. Occasionally, as in the storyline with Coronation Street, the child may get more severe central nervous system involvement. I mean, that really is unusual, but sometimes the children will present with a pattern of illness that looks a bit like meningitis, and that clearly is a more serious presentation of Lyme disease in the acute phase. And then if it's untreated, there are a number of issues that Lyme disease can cause long term. But I think the most important thing is recognizing the early signs and symptoms so that any child who is exposed and then gets any of those kind of symptoms gets treated and they don't get long-term problems.
When should I take my child to a doctor if I think they might have Lyme disease?
I think it's great if parents are even thinking about Lyme disease, because one of the things that we are very aware within the profession is that there's not much awareness, even when children go off on camping trips and so on. I think that's getting better. And again, the Lyme Disease UK website gives schools some equipment to if they're sending children off on camping trips, and things like the Duke of Edinburgh Award are now very aware of these risks. So the first thing is even thinking about Lyme disease. And then if you are a parent and your child, I mean, particularly if they've been on a camping trip and then they get either a rash or a nerve palsy or this summer flu or unusual symptoms that cannot be explained by something else, then please do take them to your GP, to the family doctor.
How will the doctor diagnose Lyme disease?
Yeah, that's a good question. So this is really important, that when you're bitten by a tick for the very first time and unlucky enough for Lyme disease to be transmitted, the body produces an immune response, but it takes time. It takes weeks for this particular bacteria to initiate an immune response that is measurable. So if you present within a week with a erythema migrans rash, this red ring-like rash that I was describing, then the blood test is still going to be negative for Lyme disease. So the family doctor or the specialist who you see, I hope, would be able to assess the risk, take a careful history, and decide on the history and what they're seeing on the child that this is probably Lyme disease and get started on treatment. And in fact, I wouldn't even recommend sending blood at that stage. There's really no point, because a negative test doesn't help you. It doesn't tell you that the child has not got Lyme disease. And so therefore, if you want to prove it, it's quite sensible to wait at least 4 weeks, probably 6 weeks from the time of the tick attachment before doing tests for Lyme. And the crucial thing is to get on and treat it as soon as any signs or symptoms appear.
What treatment will my child be given if they have Lyme disease?
This is very well understood, and there's clear guidance, which is now at least 10 years old, from the National Institute for Clinical Excellence, a description of Lyme disease treatment for children of different ages that crucially involves high dose antibiotics. And typically it depends on the age of the child, but amoxicillin may well be the first antibiotic of choice for the younger children, but it has to be given in high dose, in 30 milligrams per kilo per dose, and that has to be given for 21 days. So this is not, it's not like a sore throat that needs 5 or 7 days of treatment. This is more serious. You do have to ensure that your GP or whoever's prescribing for the child is aware of the guidance, and that the child will need 21 days of treatment. And then, you know, even with a first course of treatment, sometimes that's not enough. And I've seen children who've developed symptoms downstream, further headache or tiredness, fatigue, listlessness, loss of appetite. And then it's okay to treat with another antibiotic for a further period of time. And generally speaking, that's very successful. But high dose antibiotics are the answer.
Will my child get better after the treatment for Lyme disease?
Yeah, my experience is, and also the experience of European pediatricians and others specialists who see a lot of Lyme disease. If you catch this early, if you make the diagnosis and treat appropriately, and if the family is well organized and can manage to give the child the treatment for 21 days, which I admit is not easy, then in fact the outcome is excellent, and the vast majority of children don't end up with any long-term problems at all.
What can I do to prevent my child being bitten?
Clearly, you want to try and prevent your child coming into contact with ticks, but that can be difficult, and we don't want to wrap our children in cotton wool. We want them to go and enjoy the outdoors. And so there's some very sensible advice. Again, go to the website, have a look. Clearly, insect repellents that repel ticks are very wise if you're going into places where you know there are ticks. Wearing long sleeves and long trousers is advised, but frankly, in the heat of summer, I don't think it's terribly practical. And wearing light colored clothes so that you can see the ticks on the clothing and be alert that they are around, that's also sensible advice. But probably the most important thing is being aware of where the ticks may be, and then being vigilant about having a very careful look at your child at the end of the day. I mean, the ticks tend to sit there and they can feed, if they're not detected, for days. And then gradually get more and more engorged, so that then it becomes more obvious that there's a tick attached to the skin. So in the first few hours, there's very unlikely to be transmission, and it's fine to leave it till the end of the day. I mean, you don't want to be inspecting your child every 10 minutes while you're out in the countryside, but at the end of the day, have a very careful look, and if there's a tick, detach it, and hopefully there'll be very little risk of transmission.
What do you think are the most important takeaway messages for parents concerned about Lyme disease after watching this storyline unfold on Coronation Street?
The child in Coronation Street ends up with a relatively later diagnosis and with quite significant complications, with more serious manifestations. I think that the message I'd like to get across is that the more aware the public and the professionals can be about ticks and the potential for transmission of infection, the better, so that everybody is a little bit more alert. I think this is with global warming. We are aware that the tick populations are expanding, and it's more likely that in the future children will come into contact with ticks and potentially tick-borne infections. So everybody being a bit more aware is a good thing, and I think that's fantastic that Coronation Street have tackled this. And I wouldn't want people to imagine that every child with Lyme disease is going to get the kind of problems that Joseph has had. In fact, if it's picked up earlier and treated appropriately, the children are going to recover and not end up with difficult to treat disease. It's very, very unusual that we'd end up needing to use hospital-based care and intravenous antibiotics for children with Lyme disease. That's the honest truth. And this is treatable, and it just needs to be picked up earlier enough.